Assalamu alaikum. Today I would like to talk about infection of the prosthetic joint, especially after endoprotez surgery of the hip and knee.
Dr. Rashid.
As we all know, across the world there are a lot of surgeries of the hip and knee, especially endoprothesis. More than 500,000 patients across the world undergo endoprothez surgery of the hip and knee. Now it is expected that some of these patients, especially about 1% of these patients, develop infection of the joint after the surgery. This is a very catastrophic complication after the surgery. Now, in order to prevent this dreaded complication, we need to be very careful at the time of selecting the patient. We should look for any risk factors such as any local infection, any tooth infection, any urinary tract infection. Does the patient have a good immunity status? Is he suffering from conditions like rheumatoid arthritis, or is he receiving any immunosuppressants for certain skin disorders? Is he on steroids? Diabetic mellitus is one of the risk factors. Does he smoke and drink? All these various risk factors can contribute to development of prosthetic joint infection. So before the surgery, we need to gather all the information from the patient in order to minimize this risk of infection. Now, once infection happens, usually this can develop within few days after the surgery. Now, patient usually presents with discharge coming from the wound of the surgery. So it is very important to detect this complication as early as possible, so that we can give necessary treatment. Once you see a discharge coming from the wound, we should take a backpassive of this fluid which is coming out from the wound and send it for culture and sensitivity. Also, we need to do blood investigations such as ESR, CRP, blood culture of the patient in order to look for any hematological indicators suggestive of infection. Once infection is confirmed, we should not lose much time. As early as possible, the patient should be taken to the theater and the wound should be opened, thoroughly debrided, and depending on the time of presentation of the patient. If the patient presents very early, we can retain the implant, just do good debridement and place antibiotic spacers made from the bone cement, which is mixed with powerful antibiotics such as gentamicin and vancomycin. And these are prepared in the form of beads, and as we can see in the clinical photos here, and placed inside the wound. If the patient presents early, this treatment is quite successful and helps in suppressing the infection. If a patient presents late with the formation of the fistula or sinus, with the wound quite open, in that situation it is we'll have to go for removal of the implant, placing antibiotic spacers, and then subsequently doing revision replacement. So this is in nutshell about joint infection. The message we are trying to give is to detect all possible risk factors before surgery, and during surgery observing strict sterile precautions like how we do in our operation theatre setup, and educating all the staff assisting in the surgery, making sure that this surgery is conducted in the most sterile manner, and subsequently early detection of this infection. This will help in preventing major surgery such as revision arthroplasty, which can be very, very devastating to the patient. Thank you.
Atos.